Hi, I'm Kavita. I'm here today to get my mid facelifting done with Silhouette Soft threads. These threads are coming up in India for the first time, and I'm getting it done with Dr. Gupta. As everybody knows, Dr. Gupta is one of the most famous plastic surgeons in Delhi, and I am very excited to get it done for my mid facelifting, just to get rid of this monkey face.
So hello, good morning. Today we are demonstrating Silhouette Soft Lift for mid-face and the jawline correction. Today we'll be demonstrating this on a patient. She is in her mid-30s. She is young, she is beautiful. You can show it to the patient. She doesn't have too much of sagging for her lower face. You can see that she has good amount of nasolabial lines. She has had filler around 4 months back. So they have improved, but she's more worried and she wants them to be corrected. So if we lift mid-face like this, her nasolabials get corrected, as well as she has started developing some jowls. If you can see, her jawline definition is good, but we can further improve it if we can do a lift like this. What we'll be using today is a Silhouette Soft 8-cone thread, which has 4 cones in each direction. Remember, this is a bi-directional thread. So first we will mark the area which we need a lift. There is one entry point in the middle and 2 exit points. So we want her jawline to be lifted like this. So my entry point 1 will be here. I would like to keep a distance of around 6 centimeters from the entry and the exit point for the jawline correction. So this becomes her one exit point. And this becomes her second exit point. As far as her nasolabial is concerned and mid-face lift is concerned, we need to mark for correction of the nasolabials. Sometimes it becomes difficult to get a 12 centimeter marking here. So what we are going to do is something around 10 centimeters for the nasolabial. From the exit point remains the same, and in the middle, the 5 centimeters one becomes the entry point. Measure from here 6 centimeters, one exit point. It's around 10 centimeters. That they are symmetrical on both the sides. Always and always remember that the markings for this should always be done in a sitting position. So this is all the material we need during the procedure: a sterile gown, drapes, gauze pieces, sterile gloves, preferably powder free, marking pen, ruler, 18 gauge needle, a scissors, lignocaine with ADR 2%, and I prefer to inject it with 26 gauge needle, so you need a 26 gauge needle as well. Local anesthesia at the entry and the exit points. So intradermal injections, small boluses of the local anesthesia. So we recording it?
Recording it.
So we open the pouch, which is silver foil. Remember, the pouch inside is also not sterile. Is sterile, and that should be held by the surgeon. Once we open this, we can see. So if you see, there are 4 cones in this direction and 4 cones in this direction. Yes. So before, and you can see, also see that there are some knots here and in front of every cone. Before we insert, we just tighten them up a bit. We need to make a hole at the entry point. I'm using an 18 gauge needle. I would like to pinch the skin so that it pains less. Make a good hole. Just move around the tissues so that the hole is good. There is a black mark in the needle of the thread. This black mark is so that once we insert the needle, it has to be inserted perpendicularly till we reach the black mark. That signifies 5 millimeters. And so once we reach there, then turn your direction. Only go deep. See, the black mark is gone inside. Then turn. Make a tunnel till your. If I move the needle like this, I shouldn't see a dimple on the skin. And if I lift the skin, it should be liftable. That means we are in the right plane. Once we reach the exit point, we take the cap off a needle, make it as a guide, and pull the needle out. Right? If you are pulling, you will see that you find an obstruction when the knots reach at the entry point. Can you see this?
Yes.
Now, this is the most important point of the whole procedure. You don't have to pull this forcefully. The thread might break. What I do is, make a constant pull from your left hand and just do a traction from your right hand. The knots will go inside slowly and slowly. If you see, the 2 knots have gone inside. So, very gently, you can put all the knots inside by pulling the tissues up. Similarly, now, to the same entry point, you put in another edge of the needle. Again, the black has gone in. You go in, change your direction towards the another exit point which we have already marked. Maneuver to see whether you are in the right plane. You should not have any dimple on the skin. To put the needle out. You see, all the thread is going inside. Compress the tissues to each other and you will see feel a click click sound where the cones are engaging. Leave the threads long because I want to tighten these threads once the patient sits post procedure. Again, make a good puncture with an 18 gauge needle, and once the black hole goes inside, change the direction till your exit point. You pull the tissues in, make the cones go in. Yes. Same step, the black goes in, change the direction. Using the just compress the tissues so that the cones get engulfed in the tissues and they catch the tissues in. So, it is always a good idea to pinch the skin, make a good hole, free the tissues, good hole, free the tissues, go perpendicularly to the skin till the black mark disappears. Make a tunnel. This shows that we are in the right line. Bring the needle out.
You see? Till the black mark disappears, change the direction. Till the black disappears. Then turn. Redo the opposite side. Till the black goes in. Change the direction.
Once the patient sits, right then, for a desired lift, you want So if you notice, immediately also her jawline has improved. This has got a better definition. This has got lift. The nasolabials have also got blunted. Similarly on the opposite side. The result will keep on improving for next 1.5 months because of the collagen which is stimulated for form, the tissues get engulfed in the cones, the capsule get formed and they get a more tightening feel.
Hi, as you can see, I'm done with my procedure and it was quite comfortable and pain-free, and I can feel the tightness on my face. But as you know, the complete result will come in 1.5 months. So I'm very excited and very happy. Thanks to Dr. Gupta for doing